Hi everyone. Uh, I thought I'd make this video. I thought I would get something, out there. Uh, I'm hearing a lot of talk about the Affordable Care Act. I don't like to call it Obamacare because, quite frankly, Obama just doesn't care. But they, it's funny that we have some people out there, some politicians out there that are trying to figure out how to get rid of the Affordable Care Act. How can we change it? How can we get rid of it? And, you have Ted Cruz that was, he's against the Affordable Care Act. We've got some of these other uh, people running for president that want to get rid of it. We've got Congress that's trying to figure out how to get rid of the Affordable Care Act. And their whole idea in Congress is to replace this government mandated program with another government healthcare program. It just doesn't work. Now, I wanted control over my healthcare. And so I signed up for a medical co op called 100% Healthcare Now. I think it's going to be the game changer. I think it's the answer to the Affordable Care Act that a lot of the politicians, a lot of are looking for in this presidential election that's coming up, 2016, not that far away. And and I think if Congress looks at 100% health care now, they're going to find the answer there. It is pretty much the game changer, I think, for affordable health care in this country. And I think it's definitely going to get our country back on track, especially with with many people that need health care. Now, the media is not talking about how about medical co-ops. They're not. They don't seem to be really big on the idea of medical co-ops. So pretty much this is what medical co-ops are all about. It's basically it's not health insurance, but it is health assurance is like what I like to call it. And basically medical co-ops were the way they handled healthcare in this country. For example, it was big in the mining industry. It was big in a lot of industries actually. When a worker got hurt, that worker and their coworkers would pool their money together to make sure that that person got help, got the medical attention they need. It was basically neighbor helping neighbor. That's what it was all about. And so that's the answer to this whole thing. Now, it's not free health care. You pay into it. It's pretty much like a medical savings account. In fact, the insurance companies, the one that sells, the ones that sell health insurance these days, like many other insurance companies, they evolved from co-ops. So going back to basics, which was medical co-ops, is the answer to this whole thing. Now, you're probably wondering, okay, why am I gung ho on 100% healthcare now? Pretty much, I like the idea of it that it's basically taking us back to the time that co ops were popular and that co ops were mainly there to help people. And that's what this co op is trying to do. Now, the co op was started by Ruth Bryant White back in 2006. It was actually called the Alexander McGee Medical Co op Foundation, but Ruth White changed it and called it 100% Healthcare Now. Now, Ruth White was a independent candidate for president back in 2008. She had this as her platform. Well, let's say it just kind of got shoved in the background, but it has now come to the surface. It's been reformed to become 100% healthcare now. And she changed the name because she wanted people to be able to identify it with healthcare and be able to have a simple explanation as to what it's all about. Now, if you go to www.100%healthcarenow.com, spell out percent. So it's 100 100%healthcarenow.com. Now, if you go to the website, you'll find out more information about the co-op, but you'll also be able to sign up online and purchase co-op membership online. You're purchasing a membership that pretty much will guarantee that you're going to have affordable health care. Okay? Because we're all paying into it. It's neighbor helping neighbor, like I said. It's the way insurance, well, it's not insurance. It's the way healthcare coverage should be. Neighbor helping neighbor. I'm all for that. As long as everybody pays into it, I'm all for it. But I'm kind of hoping that millions of people are going to see this and they're going to sign up for it, because I'm seeing the costs are low for membership. It's like $25 for a single adult per month. So that's like $300 a year. The medical co-op for animals is $8 per month per animal. It's like $96 per year per animal. You know, it's each individual animal, so you have to buy kind of separate packages for that. And it's the same way for the humans, because if you get the adult membership, it's per adult. Now they're going to have stuff for families as well. I'm seeing also that you're going to get a medical card. You yourself, the human, will get a medical card. And also, for example, I was telling you about Icarus. Well, he gets a medical card too, so the animals get a medical card as well. This is a real game changer. If we want to end the nightmare called the Affordable Care Act, this is the route to go. Medical co-ops like 100% Healthcare Now. It is a game changer. It's going to change this country. And it might also put people back to work in this country, because, believe it or not, one of the things that affordable healthcare can do puts more money back in our pocket. What does that do? When we get more money put back in our pockets, we have more to spend. Okay. Now, here's another benefit to 100% Healthcare Now. If you like your healthcare plan, you like your doctors, you get to keep both. That's what medical co-ops do. With 100% Healthcare Now, well, guess what? You can use it as a supplement. So if you like your healthcare plan right now, you're working at a company, you like the healthcare plan that you have, you can use it as a supplemental. 100% Healthcare Now, you can get membership. Use it as a supplemental to eliminate copays. That's pretty much it. That's pretty much simplified. Now, I'm hoping that the media is actually going to wake up to the idea of medical co-ops. They've been asleep. They need to actually start covering it and letting people know about the co-ops. Because, you know, that's the way it was. Like I said, back in the day, for our healthcare, for our country, that's the way our healthcare was done. People help, you know, they pooled their resources together. They paid to get, you know, their fellow friend, their worker, their neighbor, get their healthcare needs taken care of. And by the way, just to let you know, they all paid into it. It wasn't free healthcare. And it really isn't free healthcare. But, you know, it is really affordable. Really, really affordable. And here's another benefit that I've seen regarding 100% Healthcare Now. We hear a lot about Medicaid and the states have their own Medicaid program. We have access here in Arizona. But here's another thing about 100% Healthcare Now that's a really big plus. If you got people off Medicaid to medical co-ops like 100% Healthcare Now, well, guess what? It is going to save our states a lot of money. Might save our government a lot of money. We'd have money to put towards other things. We wouldn't have to support other people, their health care. Now, I don't fault people for being on Medicaid if they're there temporarily. That's fine. But you don't want to be on there permanently. And I think that's what 100% Healthcare Now also gives us. It gives us, well, I don't know, medical and healthcare freedom. You know, health freedom is what I call it. Here's another benefit that I've actually seen regarding 100% Healthcare Now. If you don't have to go to the doctor, let's say you buy a membership, you're in it for a while. Here, if you don't have to go to the doctor at all for an entire year or have to go to the hospital, well, guess what? You get a dividend check at the end of the year from the co-op. I don't know of a lot of insurance plans that, well, I don't know of a lot of plans like I don't know of any insurance plan that has this from medical insurance plan. The co-ops are starting to adopt this type of structure to help people out. There's a lot of things that it will do, 100% healthcare now, but I think people need to wake up to it. I did. I signed on. I signed Icarus on. I'm proud of that because I don't want the government deciding my healthcare choices, and I certainly don't want some large greedy insurance company to choose what healthcare I get or what doctors I go to, or have to pay some high deductible. I don't have to pay some high premiums. I get hit on both ends. That's why I love the co-op. It's straight laced. If you need medical help and you need healthcare, you get it, and it's covered. That's the bottom line. So hope that you're going to take this to, you're going to, hopefully this gives you a little bit of information about co-ops, about how this one works. 100percent healthcarenow.com. Look it up. And I hope that the candidates for president, not to mention our politicians, will also look at 100% healthcare now. That's the answer right there for affordable healthcare in this country. That is the answer to the Affordable Care Act, in my opinion. You got the information. Thanks for watching. Run with it.